Okay. All right, so like I said, just another minute or two. We're just getting everybody a chance to get situated on Zoom. Maybe grab an extra cup of coffee. We appreciate you joining us this morning. Okay. And as we go, we'll definitely be taking chat. So if you have some other questions, you want to put it in the chat window. We'll do our best to answer those. And about 2 more minutes before we'll get going. So thanks for joining us. Let me take a quick PowerPoint break. I'm going to do something really quickly. Okay, like we said, we're going to get started here in just another minute. IM 5594. And if you don't mind, for those who are able to mute your phones while we're going through all this, that would be appreciated. You'd be surprised at what audio we can pick up. Okay. All right, so we are now going to go ahead and get started. Sorry, I'm just doing a last little bit of technical things here. Got an update to some slides, so.
Hey, Tim, good morning.
Good morning.
Are you recording this meeting?
Yes, we are.
I see.
So we're going to be recording this both on, right now we're going out via Facebook Live, and we're also recording the meeting, and we'll go ahead and post it also later on today.
Sure, thank you.
Okay. All right. So we're going to go ahead and get started. Thanks so much for everybody for showing up today. We appreciate you participating. Like I said, we'll go ahead and have this meeting available for you online as well. So for those who missed it, but we're also doing it on Facebook. So we've got a number of partners here that the goal is to go over a number of the different resources, kind of some different updates that are going on around the city. And of course, this is a question and answer time for you. If you have any questions, you're just trying to make sure that we're connecting the dots, or if there's anything else we're missing, please let us know. But we've got some great partners, so I want to introduce them. We've got from John Muir Medical Center, Michelle Lopez and Dr. Tom Greeley. So thank you for being on the call today. We've got the Greater Concord Chamber of Commerce on the call today. We've got Kevin and Melissa, thank you, and Visit Concord, Elaine. And we also have our city manager, Valerie Baroni, on the call today. So thank you, partners, for being on the call. We're going to go ahead and kind of roll through a few things here to get started. So again, housekeeping, please mute your phone if you're able. And again, hopefully everybody's having fun starting to learn how to use these conference call settings as best as possible. So I want to start off, of course, with thank yous. I think it's safe to say that overall, thank you to everyone who is staying home, trying to respect the order, do what they can about trying to keep the community safe. And of course, as more and more orders continue to roll out, I mean, the goal is to make sure that we're all doing our part so that we can minimize the impact on our community. But also thank you to those who stepped up to volunteer, those who've made donations, and just generally for doing your part. So we appreciate that. So we're going to get kind of started on the general current state of as of today's date. And joining me will be our city manager, Valerie Baroni. So I want to just double check. Valerie, is everything working?
Everything's working.
Perfect. So I'm going to kind of just start off. Of course, you've seen the latest orders at this point. The shelter-in-place, stay-in-home order is now been extended through May 3rd. And there's definitely been a lot of new language that's coming out around what's going on with things that are open, things that are not open as it relates to businesses and activities. So Valerie, do you mind just kind of going through some of the first few items here and talking through some of the things that are going to be closed around the city specifically, and things that we're doing?
I'm happy to do that. So this is Valerie Baroni, city manager. Concord actually had already, before this refined order came out, closed the playgrounds, the dog parks, the public picnic areas, and our tennis courts and the skate park, and all of the areas where it was more congregate behavior. And the new order made it clear, because each city was doing that a little differently. The new order made it clear that that's what the health department wanted cities to do. They also made it very clear, another area that the cities were going back and forth on, because the health department was going back and forth on it, was golf courses. The original advice we got from the health department, we thought meant shut the golf course. And so we worked with our golf course partners and did. Subsequently, they refined their advice, the health department did, and said, well, if you set it up so that there's only people going from within their own family groups and they're not using any shared equipment and they're walking the golf course, you can open it. And so as we were beginning to evaluate whether we should do that, they then came out with a new order saying, no, what we really meant is golf courses should be closed. So it's been kind of a wild ride trying to interpret what the health department's asking of the cities and trying to make sure we're in full compliance. And we've continued to do that. So what I would say is I'm very proud of Concord, because we stepped up early to do the more strict interpretations of all of their recommendations. The one that was kind of interesting is, our parks are getting heavy use right now, but we have social distancing advice in all the parks, and we this new order is, I think, pretty interesting, which is you're not supposed to share your balls. So any game you would play that would have shared equipment of any type, you're not supposed to play. They really want us to help the community ensure that social distancing is occurring, even as people get out to get a little fresh air, because they're going stir crazy in their house. Another one that was a big hit is the original order had residential construction allowed, and made it clear that commercial construction, unless it was to tighten up the building and protect it, wasn't allowed. But they came out with their new order basically saying that all construction is prohibited, unless it's affordable housing construction. And by that, they mean specifically affordable housing construction, not projects that are paying in lieu fees into affordable housing. You can, weatherproof and tighten up and leave your site in a safe way, or if it was super close to being done, and it could be done super quickly with social distancing, you could finish it. So that's been obviously another major hit on the economy, because basically all construction in Concord stopped with very, very few exceptions. We are still doing plan checking for people who have applications in, but they can't start construction on their projects. Funerals limited to no more than 10 people attending. That's actually, I think, a loosening of it, because I think originally they were trying to have even fewer people in attendance. And then they amplified which businesses were essential, so that notaries, title companies, and things tied to real estate could be considered essential, along with funeral home cemeteries, moving companies, rental car companies. So they were, again, trying to add clarity to the question we're all asking all of the time: is this an essential business or not? And then the other thing they said is that essential businesses need to scale down their facilities to their essential components only. So that's been a change for a lot of our businesses as well. And they continue to reiterate social distancing is the most powerful tool to slow the spread. And they remind us, and I'm sure John Muir will do this for us, there are no vaccines, there are no cures. Getting on a ventilator or not, you're already really far into the problem at that point if you need a ventilator. So the goal is to just not get it at all. And they have added advice now for wearing masks, even just cloth masks, when you're out in public.
Okay. So thank you for that. And then just a few other things that, of course, we continue to remind everybody, and we know some people have seen it, some people haven't. But it's just reminding everybody in terms of the public parks, open spaces, like Valerie mentioned, we've been already trying to stay ahead of that as well. Essential businesses, and Kevin from the chamber and Melissa from the chamber are going to talk more about some of the different things that are going on. There's definitely some new filings and some new paperwork that essential businesses are being required to do at this point in time, if they do decide to stay open. So we'll talk about that. Childcare facilities, in terms of their operations, especially for the essential versus non-essential businesses, especially on who they're providing services to for essential workers. Another one that is kind of interesting that we saw came up is also in terms of people wanting to move. So unless you haven't already been planning to move, they're trying to actually ask you to just stay in place. Don't schedule that move right now. And they'd rather you not do that. And then, of course, the last one we get a lot of questions around landscapers and similar services that are offered to maintain a number of different areas, whether it be your home. We do get questions about that as we're trying to maintain maybe public right-of-ways or other habitability issues around residents and businesses. As long as it's being done in terms of kind of trying to maintain public safety, you will see some city crews possibly doing certain things that are out there. But in terms of all the general cosmetic related things, those are things that are being scaled back. So just wanted to run through some of those quick orders with you at this point in time. Again, I'm sure some of you have seen that, but just want to make sure those are just brought to your attention. But I want to go through some of the other things, and I know we've talked about this, but I can't, I can't reiterate it enough. The city of Concord's done 3 different things of recent. And one of them specifically has to deal with the Concord Cares program. This is a senior emergency food program and helping hands program. So this has to do, of course, with any Concord resident that's 60 or over that may be homebound that has any other food insecurities, or possibly just needs help around the home on something, whether it be running to the grocery store, pet store, pharmacy, pick up something for them. It's definitely limited to a smaller trip, smaller dollar item. We do have like a $50 limit, but the goal is just to be able to offer those services and make that available. The website specifically is called neighborexpress.org. This is something that the city of Concord specifically has put together. This is kind of coming from the things that we've put together on this. I do believe that a few of the other cities are starting to kind of jump on board. The city of Walnut Creek and Pleasant Hill are starting to look at adopting this as well. So Those are things that you may see some other cities adopting, but this is something that we put together. And we do have a phone number here that if somebody does not have technology and they still want to access that service, they can. That's the 925-338-1441. Or you can go online again to neighborexpress.org in order to sign up for that. All right, so two of the things we're going to talk about, just again, bring you up to speed. The first one is the temporary eviction and rent moratorium. Here, we wanted to just make sure everyone's seeing there is some general guidance here in terms of kind of the freeze evictions for landlords imposed by any type of utility shutoffs from COVID-19. And so this is something that we want to make sure that people understand. Number one, the order does very specifically have to deal with folks that are being impacted by COVID-19, or being able to just make sure that it is not just a general, temporary ban or rent moratorium on anybody and everybody, regardless of your situation. It is very specific. And so I say that because the idea is that while it doesn't waive your rent or waive the mortgage or waive those type of things, it does give everybody an opportunity to just kind of take a pause, especially for those who may be furloughed or laid off. It does put some measures in place to be able to help people out. If there are questions that you may have about this, or if there's some issues between maybe a landlord and a tenant, the city of Concord, you can definitely give us a call. We do have a helpline set up, or cityofconcord.org/housing. We do have some resources available on our website, and the goal is to be able to help people through this time as best as possible, so they can understand some of the different resources and things that are out there. One of the things that's been set up that is kind of a question mark is in terms of that paying of your rent or utilities. The way it's supposed to be is that for every month that you are basically deferring, it needs to be done over a 90-day repayment schedule at this point in time. So again, it's not just a waiver of all rent. It is at some point trying to make some kind of catch up. So the goal is to hopefully have good communication with those landlords. And again, if there's issues, please don't hesitate to reach out to us. We'll do what we can to help in that situation. The last piece here, and I apologize, I don't have a lot of in terms of finishing off this slide, but actually I wanted to have Valerie Baroni, if you can go ahead and kind of give us the update on the support of the housing some of the unsheltered at this point in time. The city's also done some things around that as well. Valerie? Where'd she go? Might be unmuted.
There you go. Can you hear me now?
There we go. Awesome. Thank you.
Sorry, they said you could press your space bar and be unmuted, but it didn't work. Anyhow, this is Valerie Baroni, City Manager again. So the Concord City Council took a number of actions early on to create like a suite of efforts to help our most vulnerable during the COVID-19 crisis, including passing the eviction and rent moratorium and applying it to commercial and residential properties, putting money aside so that we could support a program to house our most vulnerable who are unsheltered, supporting the placement of porta potties with hand washing stations out in some of our parks, specifically for the use of homeless who don't end up in a sheltered program. And of course, with the CARES program, the mayor was just talking about supporting that so that the Meals on Wheels could really amplify their program and begin serving even more seniors who were shut in and or other vulnerable people who were shut in due to the COVID-19 crisis. So in terms of the support to house the unsheltered, we established 10 hotel rooms very quickly and worked with CORE, which is the county homeless outreach team, to identify the most vulnerable members who would likely be successful in the program. So somebody, if you put them in a hotel room, they would manage to be able to stay in the hotel room and not get kicked out for inappropriate behavior or something. And so CORE immediately filled those 10 rooms, and we actually expanded it to 11 rooms at the request of the school district when they found a family that was through the school district that was about to lose shelter. So the vast majority of the people in the hotel rooms are families with young children. However, we do have a few where it's individuals. One person's on dialysis, one person has a lung condition. and where they are also part of the program. We've also had success housing 2 families since they started in the program, so we've been able to refill those hotel rooms with new at-risk community members. And we have enough money set aside that we can continue to house people at least through the beginning of June, because we anticipate that the shelter-in-place requirements may very well get extended past the 3rd. And we want to make sure we don't run out of money and have to kick people out. So that gives you a sense of what we're doing with that, sheltering some of our vulnerable homeless residents.
Thank you.
And it's a partnership with the county.
Okay. So thank you for that. I do want to go back really quickly to the Concord Cares program. I believe if you do go on the website, it says that there was an end date of April 7th. But that date, of course, has been extended just because the emergency order has been extended. So at this point in time, it will be extended through the, May 3rd timeframe. So that's something that it's not going to end. It's not going to be ending next week. It will be extended, and we will make that available for the coming weeks. So there's no end on that one. Okay, just again, continue to remind everybody that the most up-to-date information regarding the city and some of the things that we'll be doing is on the city website. We do specifically have a COVID-19 website where you'll have a number of updates that things are going on in the city. The Concord Connect mobile app is also another place to where, especially around kind of compliance, is something that we're just trying to make people aware of, that if you are concerned and you do see something that may be going on, we do have the ability under the police department. You can actually report folks if there may be a business or activity or something going on that you're concerned about. It does give you a portal to be able to report that, and then we can follow up on that specifically. Okay. Let's see here. All right. And then, of course, just a reminder, the county website itself, they do have a dashboard in terms of kind of finding what's going on countywide, as well as the most up-to-date orders. Again, we're going to go ahead and try to pull that information over, and we'll continue to share that information out to you. And also, if you have questions, don't hesitate to send us a note, send me an email, or any of the council members or the city. We'd be more than happy to help kind of connect dots for you and make sure you've got the most up-to-date information. Okay, so at this time, what I'm going to go ahead and do is I'm going to introduce Michelle Lopez. She is a registered nurse. She's a senior vice president and system chief nurse executive, along with Dr. Tom Greeley. He's the vice president of clinical affairs, and they've got some slides they'd like to share with us. And so go ahead and please take it away.
Thank you so much, Mayor McGallian. Dr. Greeley and I are really honored to be asked to come and be part of this town hall. We want everyone in our community to know that John Muir Health nurses, physicians, clinical and support staff are here ready and able to care for our community. We know that there are a lot of concerns and questions that many of you in our community have. And we share with you that this is a truly unprecedented time in healthcare and in the world. And we have been preparing for something like this for quite some time. And we wanted to just take an opportunity to share with all of you what we are doing to keep our employees safe, our patients safe, and our community safe. Before we start, I also want to thank the community because we have early signs that the social distancing that everyone has taken to heart is working. And so we want to reemphasize how important that is. And so we're going to talk a little bit. Dr. Greeley is going to get us kicked off talking about the coronavirus, COVID-19. I will speak about what we are doing and what we have been doing to prepare for this. And then we are more than willing to answer any and all questions that anyone on the call has. So I'm going to go ahead and turn it over to Dr. Tom Greeley. He is our Vice President of Clinical Affairs. Thank you so much.
You can see us practicing our social distancing there. I'll add my voice of thanks to Michelle's, both professionally and personally. Michelle and I both are residents of the city of Concord, so we're thrilled to be able to participate and talk about what we've been doing. Next slide, please. Thank you. So this is a high-powered picture from an electronic microscope of our foe, of COVID-19. COVID-19 is a coronavirus. Corona is the Latin word for crown. And if you look at this picture, you can imagine the crown around the, there you go, perfect, around the outside of the virus. And that's how it got its name. Next slide, please. So what is COVID-19? Well, first, let me talk about where COVID-19, the word came from. The C&O comes from coronavirus, which is the type of virus that we're dealing with. VI is virus. ID is infectious disease. And 19 because it occurred in 2019. So that's how the name COVID-19 came up. It's coronavirus infectious disease of 2019. As I've already said, it's caused by coronavirus, and these aren't new. There are 7 coronaviruses that are known to cause disease in humans. And they're all a particular type of virus, an RNA virus that refers to the genetic material in the virus. So although COVID-19 is a new member to the family isn't new to us. With COVID-19, the most common symptoms are fever, cough, and shortness of breath. And important to note that 80% of the cases are mild to moderate in severity. It's spread by respiratory droplets and on contact with infected surfaces. And this is an important point to remember. That on average, an infected person can spread the infection to 2 to 3 other people when they're not taking any measures to prevent that. So if they're not wearing a mask or they're not doing social distancing. And then there may be some spread, fecal-oral spread, because it is found in stool. Next slide, please. So the incubation period. Incubation period refers to the time between someone contracting the virus and actually showing symptoms. And that can range from 1 to 14 days with an average incubation period of 5 days. In terms of infectiousness or how likely someone is to pass it along, people have the ability to pass the virus on from approximately 12 hours before they ever have symptoms to 5 to 7 days after they develop symptoms. And that's an important reason why the CDC has now come out with the recommendation. And you'll notice that both Michelle and I are wearing masks, as are everybody, all our employees, all our physicians in the hospital. It's not in this circumstance to keep us from getting corona. It's in the off chance that we may have it and be showing no symptoms. So it's to prevent us from passing it along. When we're providing direct patient care, there's different PPE or personal protective equipment that we'll use to prevent us from contracting it from the patients. But for folks in the community who are now being asked to wear a mask, that's why you're being asked to do that. The estimates range from 20 to 60%, depending on where you look, in terms of the number of people who may actually have coronavirus, not have any symptoms, and be able to spread it. Next slide, please. So this is a graphic representation of why social distancing is so important. If you look at the tall purple curve, that's a pandemic where the community has taken no intervention. And you can see there's a very rapid and steep peak to the number of infectious cases that occur. Versus curve number 3, the lower, which is a more gradual, slow, and not nearly as high a peak. And that's a pandemic outbreak when there has been an intervention by the community, when they've taken steps to social distance and prevent the spread. Next slide. I apologize, this is a really busy slide, but I'll point you to the important parts of it. It is an actual demonstration of just what we showed in the last slide. And this is what happened with the 1918 Spanish flu. You can see the big peak, big yellow peak, that was Philadelphia. And it took Philadelphia 16 days from their first case to when they actually socially distanced. So you can see how high it is, versus the experience in St. Louis, which is the lower curve, the blue line, the gray. They took 2 days from the first case to socially distance. So that's why it's so very important to do this. There's actually science behind it. And fortunately, our public health professionals and our government officials in the Bay Area in particular were very quick to respond. And it's probably in a large part why we're seeing the type of curve that we're seeing, which is much more like St. Louis than it is Philadelphia, much more like or might be very different from what they're experiencing in New York, fortunately. Next slide. So what can you do? Social distancing, is it essential? I think we've said it before, but we'll say it again. Absolutely. It's the most important thing that we can do to slow the spread of coronavirus. When you cough or sneeze into your arm or tissue, and make sure you wash your hands or use alcohol-based gel frequently. Try to avoid touching your face. When you're wearing a mask, it's a good idea to Purell or wash your hands before you touch your mask, either put it on or take it off. And please, if you're sick, don't go to work. You may not be certain, but don't go to work if you're sick. For those essential employees who are still going to work, that's the advice that we give to our employees and I give to everyone in the community. If you think you're sick, don't go to work. Next slide, please. I think we answered that question. Next slide. So some medical countermeasures. Testing is important. We don't have the amount of tests that we'd like to have in the US in general, and certainly in California and locally. We do have some tests available. We expect increased availability soon, but we don't have the number of tests that we need. It's important to note that this test is very, very sensitive. As you want for any screening test, when you use a test to screen a group of people or community for disease, you want it to be very, very careful in catching everybody who has the disease. And this test is that test, very sensitive one that's available. For potential treatments, City Mayor Manager was absolutely correct. No known proven treatments for coronavirus exist currently. There is an antiviral medication that was actually developed for Ebola that has shown some effectiveness and is being used in some clinical trials and in certain cases. Then there's hydrochloroquine and chloroquine with azithromycin. Hydrochloroquine and chloroquine are actually malarial medications, and this combination has gotten lots of press from the president, and it's being used in very controlled circumstances. At this point, we have no idea what the correct dose. We have no idea when in the disease to use it. We don't know what the potential side effects are. So there's lots of information we don't know. It's being studied, and again, in very rare circumstances, usually for folks who are very severely ill and we have no other choices, they are being used. There is no evidence that they work for prevention. No evidence. So there's no reason for people to try to get a prescription or to begin taking them because, again, no evidence that it's effective there. And vaccines are still several months off. Lots of work is going on, of course, with vaccines, but several months off. Next slide, please. And the reason why vaccine is important is coronaviruses, like the flu virus, tend to be seasonal. So it will not be uncommon if we expect to see coronavirus same time next year. For a host of reasons that I won't go into, particular viruses tend to like particular seasons. And this is the season for coronaviruses. Remember, this is the 7th in the family, and the other coronaviruses we see every spring. So a vaccine will be very important to make sure that we can control it. Should it show up again next year? There's no predicting. It may show up next year. It may not show up next year. We just don't know. Next slide. Michelle now is going to go over some of the efforts that we've taken here at the medical center, both medical centers, all of John Muir Health, to prepare for coronavirus.
Thank you, Dr. Greeley. All right, so early this year, we had been carefully watching what was occurring in China and Italy, and we knew that it was a very real possibility that it would spread to the United States. When the first patients arrived in California from the Diamond Princess, which was just over a month ago, it feels like about a year, but it was just about a month ago, we doubled down on our planning efforts. And when the first community-acquired patient was identified, we knew without a doubt that we needed an all-hands-on-deck approach to planning, and that's exactly what we did. We have a hospital incident command process that we have in place for any disaster that may come our way. And we opened up our incident command center on March 4th, and it's been open 24/7 ever since. And we have over 30 work groups of leaders and clinicians and staff that have been planning for what we have anticipated as an increased number of patients. We're working on our capacity, making sure that we have the right number of beds, critical care beds, medical surgical beds, space in our emergency departments, making sure that we have enough staff to staff this increased patient population, as well as logistics, all of the things that we need to take care of this surge of patients. We have been planning also for quite some time around personal protective equipment. And you may have heard on the news, stories from New York City, for example, of concerns about not having enough personal protective equipment. We believe that we have the personal protective equipment that we need to care for these patients and to keep our employees safe. And we continue to get more. There's no stone left unturned. And we feel very, very prepared for this. We are incredibly proud of the commitment that our employees and physicians have made to this. I cannot begin to tell you how our teams are fearlessly leading in the face of the fear that I think we all feel. We are constantly taking proactive steps to make sure that all of you can count on us during this critical time. And we are planning for what we're phrasing as a possible worst case scenario. But as I said earlier, and Tom reiterated, we are starting to see changes in the curve, and we are cautiously optimistic. That being said, we are not taking our foot off the gas. We are continuing our planning for what could be the worst case scenario to make sure that we have everything we need to care for our community. Next slide. So what have we done changes-wise to make sure that we're able to keep our community safe? Very early on, we consolidated our urgent care centers, and 4 of our largest locations we consolidated to make sure that we had enough clinicians and staff to care for patients with specific focus on respiratory patients. We've increased our outpatient testing by adding mobile testing sites to our Brentwood and Walnut Creek urgent care centers. And this has allowed us to get more patients through testing, but also do it in a way that we are keeping our community, the patients, as well as our staff safe. We're using telehealth and phone visits. We are doing about 1,400 to 1,500 telehealth and phone visits every day. So for patients that works for, it has been incredible. It's been incredible. It's something that we have been working on for quite some time, and our physician network was able to stand up this technology very, very quickly, and our patients are really, really benefiting from that. We've postponed elective surgeries and procedures, and we did that at the guidance as the CDC and our other agencies were recommending that we do that. This was quite possibly one of the more tougher decisions that we've made, because we know that it impacts patients who have been planning for these elective surgeries and procedures. But by doing this, it allowed us to make sure that we had the workforce focused on the potential COVID-19 patients headed our way. It allowed us to preserve our supplies, our personal protective equipment, and making sure that we had the space for patients that might be coming our way. Next slide, please. So, whoops, one back. We also put a visitor restriction in place, and again, this was a very difficult decision for us, because we know that hospitalized patients, it is very important that they have their families with them. We have our ITS department and our clinical teams are working right now on how can we leverage technology, whether that be through iPads, through Facebook portal pads, et cetera, for our patients to be able to talk with their families virtually instead of in person. And so we are doing everything we can to mitigate the impact of having those visitor restrictions. But we believed very early on that, again, protecting our workforce was vital, because if we have our workforce going out sick, we won't have what we need to take care of patients that may be coming our way. We are masking, as Dr. Greeley commented, we're masking all personnel, visitors, and patients in all clinical buildings. Dr. Greeley and I are at the Concord Medical Center now, which is why we are masking. We're planning for taking temperatures on all physicians, staff, and visitors that are entering our patient care buildings. We have a work group that has been working on that, and we plan to roll that out early this next week. And we are continuing to focus relentlessly on hand washing and social distancing across all of our John Muir Health sites and services. Next slide. And this is one of my favorite slides. We actually, at both of our medical centers, we showed up one day and found these signs that our community placed there for our healthcare workers. And I cannot begin to tell the community how these signs of support and care from our community, what it does to bolster the spirits of our teams who are inside those buildings working as we speak. We want to thank the community of Concord. We want to thank each and every one of you who are heeding all of the recommendations out there to stay home, to stay socially distanced, because it is making a difference, and it's keeping our community safe, it's keeping our patients safe within our buildings, and it's keeping our healthcare workers safe, which is just so vital at this time. We feel supported by organizations like the Concord Chamber of Commerce and our local government. And we want each and every one of you to know that we are here and we will be here no matter what comes our way. Thank you so much, Mayor McGallian. Dr. Greeley and I are open to answering any questions that anyone on the call may have.
Sure. Thank you so much. We really appreciate your presentation today. And I think you brought up a lot of really good questions. And so what I'm going to do is let's go ahead, and there were a few questions that came in. I know that Valerie was trying to answer a few. And was there one or two? Oh, you know what, do you mind there was one about the masks in terms of people just kind of understanding the best practice for masks, whether it be cloth masks, medical masks, when to use them, when not to use them, kind of the appropriate nature of what that means. I mean, it's one of those, should they be wearing them when they're at home? Should it be only when you're in the store? Like, just kind of that best practice around masks so that can be understood.
Got it. Wait a second, I'll just talk from back here. Okay. So the guidance from the CDC was to wear them when people were out in public, not necessarily at home. For those that we live with, unless we're going to stay 6 feet apart, not touch anything in common, exposure, the ability to avoid exposure is almost impossible. Certainly out and about in public, the recommendation is to wear masks. Not medical grade mask. You could wear a bandana. You wear a cloth mask. They specifically ask that people not try to wear the N95 mask, which is the medical grade mask that we need for our employees who are providing care to patients with COVID-19. So any barrier, again, cloth, if you tend to have simple masks like Michelle and I have on, these will be fine, but wear those when you're out in public.
And as far as cloth masks for caregivers, there's been a lot out in the media about this, and we have had an outpouring of support from our community wanting to do things for healthcare workers, making masks, etc. We have gladly accepted any and all donations, but at this point, we absolutely have the amount of hospital grade PPE for our employees. And so we are having our own employees wear the masks like Dr. Greeley and I have on now. But for the public, the cloth masks are just fine. Again, it's to keep yourself from exposing others when you're out.
So another question came in because, of course, we're talking with John Muir, but in terms of that relationship with Kaiser as well, do you kind of know what's going on in terms of whether someone who maybe is a Kaiser patient, can they go to Kaiser or can they go to John Muir if they're concerned about testing? What's the best practice on that among kind of the medical community dealing with COVID, no matter the hospital?
Yeah.
I would say, as is the case always in medicine, if you can keep your care with your providers who know you, that is ideal. However, any health system in the county, anywhere, will provide care to anybody in need. So testing throughout the state, throughout the county, throughout the nation is limited. But my advice would be, if people have the option or able to follow up with the system or the provider that they normally seek care with, they know you best, they know your medications, they know your history. That's ideal. But if someone in need, you can go anywhere.
And the follow-up to that, though, and just to make sure we clarify, is, where should testing start? What does that look like? I mean, is it literally just, hey, is it drive up, or should it really start with your primary care? Just so that people kind of understand what that first point of contact should look like.
Yeah, so, the message that we're getting out to our patients is that if you are mildly ill and you have the symptoms that are fever, cough, et cetera, the symptoms that we're seeing with COVID-19, you should call your primary care physician. At John Muir Health, we have the ability for our patients to call, and then they will be directed where to go, whether that will be to one of our urgent care centers. If people feel sick and truly sick, like they need emergency care, they can show up at one of our, obviously, emergency rooms, and that's the same for Kaiser, John Muir, wherever you get care, you're more than welcome to show up. But again, it's important that if someone is feeling very sick, they can go to any emergency room and they will get care. It's also important to know that just because you want to get tested does not necessarily mean that you will get tested. Our physicians will be assessing each patient, and if there is a high likelihood that this could be COVID-19, you will be tested. But a lot of people think that they can just show up at an emergency room and just ask for a test, and we simply just do not have the supply for that. We are hoping that we will get there. And I know that everyone in the United States is certainly waiting for that.
Got it. Okay, thanks so much. And I'll take another question or two, and if I may have missed one, Valerie, I know you were responding. Was there one or two that you saw that?
Well, there's a few that are appropriate for the medical professionals. One is, if you smoke or vape, does reducing or stopping reduce complications with COVID-19? So that's one. And then somebody asked about Sweden's approach to the coronavirus, but I don't know if we know anything about that. And the third is, how do you clean a mask?
I can take smoking or vaping. Absolutely. Stopping smoking or vaping will certainly help in case someone gets sick from anything, whether it's coronavirus or routine pneumonia. Absolutely, that will help. Yeah, for the Swedish experience, I don't have any knowledge about what happened in Sweden. And how to clean a mask, it depends on what type of mask you're describing. For paper masks, we recommend that if it's dirty, soiled, wet, torn, that you dispose of it. If it's a cloth, I don't have any recommendations other than washing, as you would, routine clothes. Hot water and detergent should kill the virus.
Okay. And then I think Melissa was checking, there might be a question on Facebook or two. There was a question about gloves, and that's kind of a good one. I think how to use gloves, again, the appropriateness of when to wear them, where to wear them. Can you kind of go over some best practices with that?
It's a tough one.
Yeah, it is a tough one, because best practice for gloves depends on where you're wearing gloves, right? Are you a medical professional wearing them, or you're out in the community?
Let's say for the common person that, hey, you know what, I'm going to go to the grocery store, and is it something where I'm going to put a mask on, but should I put gloves on? When I'm in the, how should I be using those gloves? And also, and I'm going to use the example of, okay, so I went ahead and used the gloves when I put them on when I leave the house, and I touched my steering wheel, and then I touched all the things in the stores, and I came back and I touched my steering wheel, and then I brought them home, but I didn't take them off in a timely manner. Can you kind of step through that process of when they should be used and not used, and what you should be thinking about if you're going to use gloves.
Which is why it's not a recommendation to use gloves, because of those very issues that you raised. But if someone chooses to use gloves, you should wash your hands or Purell your hands prior to putting on the gloves, and then when you take them off. And that's really the best guidance. All the things that you identified are very real. When do you take them off? And what do you do to the areas that you touch with your gloves on? With gloves on, you can still transmit virus, just like you can with your hands. So you want to clean your hands, and doff the gloves, take the gloves off as soon as you're done using them. It's a tough question.
Got it. Thank you. And I just wanted to bring that point up. I know a number of people some people may know what to do with gloves. Others, it tends to be kind of a question mark. I think you're right in terms of not using gloves, but washing your hands and making sure you're disinfecting surfaces is going to be your best bet in that regard usually.
Most effective, yes.
Awesome. Thanks so much. Okay. Any other questions? I also don't mind if one or two people do want to unmute their phone. I'm more than happy to take a question that way. And we'll do that for just another moment or two. And then we've got a few other partners that are going to speak. Anything else I've missed, either Melissa or Valerie?
What is being done to educate the homeless about the situation and to mitigate their spread as vectors?
So that's probably a better question for after our medical professional leave, because that's really done through the county. So perhaps we can narrow questions to the medical professionals so that they can move on to other important activities they have today.
And we can definitely come up with that. We'll come back to that one in just a moment. But good question.
Mayor McGallion?
Yes.
About raw fruit and vegetables.
Go ahead. I heard somebody.
Yeah, I saw a question come across the group chat, and I thought I should probably clarify, because I think that my answer around testing may have gotten some of the listeners confused. So I want to just clarify my statements. So if you feel that you have symptoms, whether you're a Kaiser or a John Muir patient, if you feel that you are getting sick and that you have the symptoms of COVID-19, you should, and if you are mildly to moderately ill, you should contact your, whatever the normal mechanism is, whether it's a advice nurse at Kaiser or whether it's your primary care physician at John Muir Health. If you go to johnmuirhealth.com, we have a whole bunch of information on our website of information to contact. If you are deemed to need to come in, you would be tested through our urgent care centers. When I was talking about emergency rooms, is if you are, you feel that you are getting sicker and that you need emergency care, that's when you should go to the emergency rooms. I just wanted to clarify that.
Okay. Thank you. Okay. And there was just a kind of a quick question in terms of recommended materials to make temporary masks. And I'm just going to kind of throw this out there. In terms of recommended materials, it says different types of cotton, but also in some cases, can a scarf work just as fine? Bandanas, what does that look like? Any major recommendation in that regard? Or is it primarily just having some kind of cover?
I would say that it's primarily just having something to cover your mouth, again, in case of a cough or a sneeze. When you're out and about.
And
okay.
He has some more specific guidance on their website.
Okay, and you said the CDC does?
I believe so, yes.
Perfect, thanks so much. Okay.
The reason I brought up homeless people during this session is because the homeless folks are dropping fecal matter all over town because 98.9% of the restrooms are locked in town that were previously accessible.
Mm-hmm. Let's see. I'm sorry. Let's see. Who was Valerie? Did you want to go ahead and talk about that really quickly?
I'm happy to talk about it, but I do think we should respect the time of the doctors first, the doctor and nurse. And so why don't we finish that and then move on to the questions that are to the city of Concord.
Okay.
The doctor mentioned that the virus is spread through fecal matter, and that really hasn't been addressed before.
Actually, let me clarify that. I don't know that there are any documented cases of it being transmitted by fecal matter. It's a theoretical possibility because it has been found in feces.
Okay. Thank you. Okay, so what we're going to do, I don't necessarily see any other questions for the doctors at this point in time. So we'd like to thank.
I do have one question about raw vegetables and fruits that we purchase at the grocery store. They may have been handled by multiple hands before we bring them home. Is it safe to continue eating raw fruits and vegetables?
Absolutely. I would just wash them when you get them home.
Cold water is sufficient, or wash them in what?
Cold water should be sufficient.
Okay, thank you.
Okay. All right. Well, thank you, doctors. We appreciate your time, and thank you for joining us this morning.
Thank you so much.
All right. Okay. So we're going to go ahead and just kind of move on really quickly. We did have that one other question that came in. So Valerie, if you want to go ahead and just kind of talk about that really quickly in terms of some of the different things that we're doing and best practices we're taking right now and why.
Yes, I'm happy to. So again, this is Valerie Baroni, City Manager. In terms of supporting and protecting our homeless population and minimizing the impacts they have from a health safety risk on each other and on our general population, we have been working very closely with Contra Costa County Health Services, which I think most people know are the lead agency in providing services to homeless folks, or folks experiencing homelessness. So we have shut most of our public bathrooms because we are operating under 3 goals: public safety, employee safety, and provision of essential services. And we can't keep our bathrooms clean enough that we are confident that they don't become a point where there is exchange of COVID-19 virus behaviors, and we can't make that happen. So what we have done, and we're also trying to discourage congregation and use of the parks in those ways. And most of our public bathrooms obviously are in our parks. So we have taken 4 porta potties with hand washing stations and put them in our parks that have the highest demand from the homeless population. We've also worked with county health, and one of the goals county health has is when there are multiple people together in tents or in encampments, to get them to spread out. And so we provided additional tents that they could use to do that outreach and work with individuals. And then of course we have started a housing program for the homeless that are most vulnerable. We also have our public works department. One of the reasons that comes up a lot is when you see our public works employees out in our parks, are they doing essential work? Well, you've hit the nail on the head. Sometimes there's absolutely undesirable things in our public areas, from needles to human feces. And our employees are out there every day ensuring that we maintain these common areas in as healthy and safe an environment as is feasible.
Okay. Thank you very much, Valerie, for kind of updating everybody on that. And again, we'll go ahead. What we'll do is we'll take some other questions on the back end. But thank you so much for that. So next up, the last few things I want to just continue to remind people about, kind of now transitioning over into some of our business related things that are going on out there, and some of the work that the chamber is going to be doing. But the first one is Concord Eats. Of course, this is something that Visit Concord, the Greater Concord Chamber of Commerce, Economic Development is working really hard just to highlight a number of our different restaurants and those that are open during this time that have the to-go or takeout options. So if you go to the Visit Concord website, that information is available. Please give them a call. We're trying to do everything we can to support a number of our local businesses during this time. So I want to go through just a few updates as it relates to food resources specifically. This is information that we're trying to disseminate as best as possible. And there's a number of different agencies that are helping provide food to our community, whether it be the Monument Crisis Center, as you can see here. They've got some updated dates on both, they did one yesterday, but they're also doing Monday, April 6th, and they're doing Tuesday, April 7th. So Monday and Tuesday at Monument Crisis, they're going to be doing food distribution. And then at Park Haven Community Church, they also distribute food on Tuesdays from 4 to 6. And so that's happening every week. And then the other thing that's going to be happening is that next week, we're going to bring you kind of the full-blown list. The St. Vincent de Paul at a number of the different Catholic churches are providing food, along with 1 or 2 other churches are also providing resources. And so we're going to bring you just a list to be able to share with folks who may need to know about those different services. Okay. We continue to remind everyone that Clayton Valley High School is doing the grab and go meals Monday through Friday from 10 to 12:30 every day. And then Mount Diablo Unified, same thing. They're also doing the grab and go at Cambridge Elementary, Meadow Homes Elementary, El Dorado, Mount Diablo High School, and Ignacio Valley High School. So those are happening, again, Monday through Friday from 11 to 12:30. All right. So with that, what I'm going to do is I'm going to go ahead and kick this off to the chamber. So Kevin, if you'd like to go and talk to us about some of the business resources and things that are going on in the business community.
All right. Thank you, Tim. I'd first like to start by thanking all the essential workers that are out there, not only the medical field, the folks that are working at our grocery stores, the trucking industry, the banking industry. I mean, there's a lot of people out there keeping us going. And with that, I think it's all for us to remind ourselves the only reason we should go out is if we do need something essential. So just keep that in mind, and we'll move on. Could I have the next slide, please, Melissa? And Melissa Ray is here with me. She's from the chamber. She's done a wonderful job on posting on all our social channels and maintaining our information. So I really appreciate that. So kind of the biggest call we're getting as of recent is about the PPP, the Paycheck Protection Program, or the other loan out there is called the EIDL. I think, you know, this week, a lot of information came down the whole week, and it changed on a daily, heck, you know, hourly. I think the most important information I can give is to start with your lender, start with your bank. That's why I have our Bank of America sign behind me today. They're a part of the chamber. They're also a bank that's funding these loans. But what I think is most importantly, before you call Bank of America, you should call your lender first. So if you have a relationship with Wells Fargo Bank or Mechanics Bank, start with them. And they'll find out the information. With that, I'd like to remind you is just don't walk into your bank. Please give a call first to someone you have a relationship with, or go onto their website. That's how we did it, and it worked well for us. I'll also remind people to go to the Small Business Administration website, and the link's here, and it'll probably be posted in the chat. If you don't have a bank, or if you want to kind of freshen up on the information and the options that are out there, so when you do contact your lender, you are educated on what you need to ask and what you need to prepare for. Next slide, please, Melissa. So I thought it would be a good idea to share my experience and how it went down. Us at the chamber, we have made an effort to really only provide quality information, things that we know are true, things that get results. So with that, I think this time, I think it would be best for me to explain how it worked for me. What I did is I called the bank, and then they directed me to the website. I went to their website, and their website had excellent information. Now, this information didn't come live that I could see until Friday. Like I said, I have a relationship with this bank. So I went on, I logged in with my chamber password and username, and then I found the information on a link for the PPP loan information. At that point, they asked me to fill in the box about my average payroll for the past 12 months. It auto-filled the loan amount for me. I had to provide a little additional information to verify, including my personal information, and then I hit submit. Now I got privately messaged in the chat by a gentleman who also did this, and when he hit submit, he had not returned a confirmation email either, and nor have I. I have not heard back. I know that I've submitted, and then we'll see what happens next. I'm hopeful in the next week that I'll have much more detailed information on this too. Melissa, could you go another slide? I have talked to a bunch of other bankers in the area who are offering these loans, and they've reiterated that they, are working mainly with their current clientele, and so, to contact them. And then the governor also talked about iBank, which is the California Infrastructure Economic Development Bank. The link is in this slide, and we can also post the link in the chat. This is a bank, if you do not have a relationship with a banker, or for some reason you don't qualify for a PPP or an EIDL loan, you can go to iBank and they can help put you with a bank that may be able to help your needs. That's pretty much the information at this time. I encourage you to go to concordchamber.com to go to our website. There's a link on the front page that will link you to the business resources page, and we have a lot of information. And I would personally, I would stay with the SBA information as opposed to anything else, and just start there. They're really the group that's going to be funding these loans and making sure that people get them. So, all right. That's about all I have, Tim.
All right. Thanks so much, Kevin. We appreciate that update. And just a quick heads up to the community. During this time, the Chamber, Visit Concord Economic Development, and myself, we actually meet every day at this point, just to make sure that we're up to date on what's going on in the community, trying to make sure that those small business owners do have what they need. So don't hesitate to reach out to any of us. We'll do everything we can to make sure that we're connecting you with those services. And of course, this is an ongoing changing thing, as Kevin mentioned. The governor had his press conference on Wednesday. Things started getting, and even the president had his press conference on Wednesday. Things started rolling out Thursday. Applications were officially allowed to be filed on Friday. So it's just an ongoing thing, and I know it's been frustrating for some, trying to kind of navigate it and understand it all. So our goal, again, is just to make sure that we're helping connect everybody with those resources, and we know how important they are for everyone out there right now. So, all right. So next up, kind of changing gears in terms of some fun things that are going on. And we've got Elaine from Visit Concord. Elaine, are you there? And Elaine, if you want to go ahead and kind of share with us some of the things that are out there that we should be aware with from Visit Concord. Hello, Elaine. Uh-oh. All right. Well, I'll go ahead and run through them then if that's the case. But some fun things that Visit Concord's been doing is just trying to kind of, give everybody a little reminder. Of course, physical distancing is A-OK, and we use that word physical distancing instead of social distancing because, of course, we're clearly social distancing ourselves right now, but we're still being very social. We're physically distancing ourselves right now. But, go on a hike, ride your bike, walk the dog. It's not a problem. Of course, check out first, though, eastbayparks.org for any parks and trail closures. Of course, there's a number of parking lots, a number of areas that have been closed. So we're not saying that everything is A-OK and everything is open at this point in time. But we do just want to remind people, hey, there are a lot of great little things right here locally in Concord. We do have some different trails and things that you're able to just take advantage of. The goal, though, is, of course, not to drive and fill up parking lots and then and fill out our parks. And so hopefully people can just respect the social, kind of the physical distancing as well when you are out and about.
Hey, Tim.
Yes.
Caroline is also on the call if you want her to pop on. from Visit Concord.
Sure. If there's anything she'd like to go ahead and add to that, that'd be great.
Oh no, that was great. The last slide, you basically covered everything that we were going to say. There have been obviously a couple of parking lot closures, so definitely check out those resources in our website. We have links to things that you might need to know. As for this slide, staying inside is obviously something that we're prioritizing right now. We have a number of media options that were actually filmed or take place right here in Concord. One is Clown House. It's from, the late 80s. So, if you want to show your kids or your family a little something spooky, that's something that's really cool. It, was filmed right here, a little bit of our town's history. A lot of stores that, are represented right here in Concord, the Veranda, Sun Valley, thrift stores throughout the community, they are offering online shopping. And so that's a really good way to still be able to support those, shops and generate our economy in a way that's safe for all parties involved. We also, on our Visit Concord website, have a list of restaurants that are offering, takeout and delivery options. All of the restaurants who are participating in those programs are taking all of the precautions they need to be taking to make sure that they're being healthy and they're making food that is going to be safe and healthy. And so that, list of available restaurants is also on our website. Yeah.
And I do see Elaine is on.
Okay. Well, you want to go ahead and finish this one up? So of course, the idea though is to support the essential local Concord businesses now. Again, we're trying to do our best to make sure that you've got that information either on the Visit Concord website or the Concord Chamber website. We've done a lot of things around Concord Eats, but in the coming weeks, of course, we're going to try to make sure that you continue to know some of the local businesses that are essential businesses that are still open, just making sure people are kind of connected so they know what's available, what's out there. And we're just trying to kind of, again, do our best during this time frame. We know that it can be a little frustrating. So, but again, thank you to all the partners and everybody that's out there during this time. All right, so let's talk about a few other things. Virtual recreation. The city of Concord, of course, is trying to try to do a few more creative things as you are home right now. There are a few different fun things that are happening. Of course, going on right now is a city challenge, Camp from Home. Take a picture of you camping at home, whether it be in your tent fort in your living room, and having fun, kind of sharing that. But also we've got some different things that we're offering, whether it be exercise classes, different yoga or home workouts, and then a number of things for the kids, just some other fun ideas. And then we're going to keep city challenges and other things updated as we go throughout the next week or two, and just try to have fun with this. And again, one of the ones that I'm hoping we're going to hopefully do in the next few days is bring back our baking challenge. I look forward to that maybe in the next week or two. It's something that is kind of a fun thing for me. So, and so at this time, what I'm going to do is just do a kind of a quick wrap up. I do have a few other partners on the call. I do want to give everybody heads up in terms of making sure people are aware of other information on a more daily basis. We have the Concord Pioneer, and that is something where their website will be updated on a daily basis. The April issue is going to be an online issue only, so we wanted to make sure everybody knew about that it's going to be coming out online here in the next, I believe, week. Or what's the date that's going to get published, Tamara, officially? Ooh, hold on, let me unmute you. What date is the Pioneer publish online this month?
It's actually published every day.
No,
we're
not
not
going to do a big
we
publish.
don't have one specific issue. We're updating every day.
Okay, so thank you for clarifying that.
Columns, feedback from the community, but I don't think that normally it's published on April 17th and delivered to homes on the 17th and 18th. But since there won't be a print issue, we're rocking and rolling. We're just posting every day and keeping it updated. Got it.
Okay, which is perfect. So again, that's the idea of doing these. That's why we're partnering with the Chamber and with the Pioneer, is just to keep everybody up to date on the local news of things that are happening right here in Concord instead of kind of on the national things. So that's the idea. So again, check out the Concord Pioneer. That's something that you'll see those updates on a more regular basis. I believe Bennu, she is someone who's one of our child care providers. And Bennu, did you want to go ahead? There were a few things that you wanted to mention as it relates to child care here in Concord and some of the things that are going on around that. I would love for you to say a few words about that.
Thank you so much, sir. Thank you for all you're doing. Everyone in the city of Concord really appreciate your efforts. We were able to get some supplies with you guys and the Cocoa Kids Help, and I really appreciate on behalf of my all my fellow providers. I just wanted to let you know that we are essential workers. We are open, and I myself have clients who are working in John Muir and Kaiser, and my other friends who we are in the same group, actually, the providers. We do have some openings, and we are here to help our community. If anybody is looking for essential childcare, we are open, we are licensed, and as a licensed provider, we were trained for all these emergency things when they arise in our community or anywhere in the world. So we are already doing best practices. We are CPR first aid certified. We are open for any challenges that our cities are facing. And we are, if there is anything I could do with my group to help anybody in our community, you are most welcome to reach out to me, and I'm here to help and serve with our services. Thank you so much.
Hey, Bennu, do you mind go ahead really quickly? What's the best place for people to go to be able to then reach out to that network, especially if you're an essential worker and you're trying to find childcare at this point in time because your kids are out of school? What does that look like? What would be the easiest way for people to do that?
So first of all, we don't do we can do it via email. And if you would like, since Cocoa Kids is closed, we were told that they're gonna connect us, the resource and referral, but I guess they are working on it. But if you would like, I can give my number or email, and people could, you could email, people could email me or call me. And since I'm the president for our local association, I could help people who are looking for childcare.
Okay, so really quickly, only because some people will be able to hear this via audio, can you go ahead and give either a phone number or an email address, and then also maybe go ahead and type it in the chat? That would be really helpful.
All right, my phone number is 925-395-7486, and I would also put in the chat box with my email address.
Okay, go ahead and give us that email address as well.
So my email is B as a boy _ my last name is C, 2 H's, A as an apple, B as a boy, R, A as an apple again, _ US @yahoo.com.
Okay. All right. Thank you so much for that. Appreciate it. And so like I said, thank you, Bennu, for that. Thank you to the chamber. And let's see, I'll go ahead and we'll take a few more questions that have come in. And again, Melissa, if you can help, or Valerie, if there's a question or two that might have come in, please go ahead and if you want to just mention them.
So I would say the number one question that I'm seeing come through for the city at this point is, what can the city do to increase the amount of testing available within the city of Concord? And unfortunately, nothing. Health is provided by the county health department, health services. The city does not have a health department. We are very different from, for instance, the city and county of San Francisco, which does have their own health department. So the county is in control of the countywide testing, and then the private health insurance companies are in control of their testing. And there's nothing the city of Concord can do to change that situation.
Okay, thank you, Valerie, for that. There's also another question that came in via Facebook in terms of kind of the rent moratorium and information being disseminated to landlords and property managers. I know that our housing department has been working on making sure that information is sent out to those different folks. And
I can do that a little bit.
Go ahead and also talk about that, Valerie.
Sure, I'm happy to. So It's actually incredibly helpful that the state has also put in place an eviction moratorium. So Concord's is stricter and includes rent increases, and we are doing an awful lot of outreach on it. We're sending it to our lists of residential property owners. We're working through our partners to get the word out to all of them. We've set up hotlines. We're using social media, and we're doing everything we can to get the word out. I think in many ways, our partners are some of our best help in this. We've created a number of materials that we've made available to them to help us get the word out.
Okay. Thank you for that. And it looks like I've got Henry. Henry's got a question as well.
Thank you, Mayor, and thank you for facilitating the town halls. I have a question for Valerie regarding what guidance, if any, the city leadership has provided the police department with enforcement of the county order for social distancing. And the reason I ask is yesterday when I left the house for the first time after 7 days to get some groceries, when I was out and about, I noticed in the Monument Corridor, there were the vendor push carts that were out and attracting a lot of people in a huddle around the food cart. And it appeared to me that that was counterproductive to social distancing. So I'm just curious to know, if I was to pick up the phone and call the police department, what guidance has city leadership provided the PD with regard to enforcement?
So our police department is very proactive on a number of fronts, and we have a team of 2 officers that are doing, at this point, what we like to call educational outreach, particularly towards businesses that are not complying, and would include things like push carts. So if you see something like that again, I highly encourage you to ideally use your smartphone app for Concord Connect and report it on there, because that's the fastest way to get the message to the right people at the city. And it also allows us to keep a track in a simple way of the kinds of complaints and the kinds of businesses where we're having issues, so we can focus our follow-up. The other alternative you have is to call non-emergency PD. And I don't have that number right in front of me, but it's easy to get. And they too will pass that message along to the right people that are the members of our outreach team on this topic.
Thank you.
Thank you very much. Another question from, it looks like Elaine.
Oh, hi, everybody. Sorry about my technical difficulties there earlier. This is Elaine with Visit Concord, and I just wanted again to say thank you for this partnership that we have with the city and the chamber, really connecting with all the businesses, the residents, getting everyone to know that we will be there in the recovery for everyone. We will be opening our brand new visitor center when this all unfolds, but in the meantime, any way that we can help you, please check out our website, all the things to do that you can do right now while we are sheltered in place. Any way we can support businesses that are online or doing takeout. We're here for everybody, and know that there'll be a really strong recovery coming out of this as soon as we can. So thank you.
Okay, thanks so much. I've got a Gabrielle. Gabriella also has a question. Do you want to go ahead and speak? Okay, I believe I also saw a question that did come in. It is regarding, I believe we're referring to specifically the Neighbor Express program as it relates to residents. Let's see here. So to be able to help seniors and disabled or immune compromised people in terms of running errands or being able to get out and do different things. So in terms of the expansion of the program at this point in time, we've been trying to keep it specifically designed for the initial group that we've tried to target. But that's not to say that as the need arises, or if we do need to continue to expand it, it's something that we can continue to do. So it's something that we definitely looked at, because there's been a number of other areas that we've looked to be able to hopefully plug possibly Neighbor Express into. And again, it's something that we're trying to just make sure we're using that resources in the best possible manner. So thank you for that question. Hopefully this next week, we'll actually be able to better address exactly some of those other things we may use Neighbor Express for. Okay, and I'm trying to see if anybody else has kind of raised your hand or is looking to ask a question. I see. Okay, so I don't see anybody else at this time. So I'm going to go ahead and wrap up. But I do want to go ahead again. Thank you, everybody that's on the call. Oh, Wayne, Wayne, you had a question?
I'm having trouble formulating it in my mind. It's too complex.
Okay, if not, you can always give me a call afterwards. It's not a problem. And I want to thank all the partners on the call again. Thank you to our city manager, Valerie Baroni, for being on. Thank you to Visit Concord. Thank you to the Concord Chamber of Commerce. Tamara from the Concord Pioneer is also online. Thank you for being a part of this. And I'd also like to thank, of course, John Muir Health for being a part of the call today. That information was fantastic. So again, if anybody has any questions, don't hesitate to reach out to either myself. The telephone number is there along with the email address. Anybody at the City of Concord offices, we're more than happy to help. Just so you know, for those who have called in, I'll give you the phone number. It's 925-695-7268. And again, thank you so much for joining us on this Saturday morning. And again, we're going to do another one of these next Saturday morning. We'll probably have look out for that meeting password and login information now that we know that has changed a little bit. And I'll stick around just for the next, say, 5 minutes or so if anybody else has any final questions they want to ask. So thank you very much and have a great Saturday afternoon.
Thanks, Tim.
All right.
Thanks
Thanks,
for letting us be on the call with you. Appreciate it.
Thanks, Tim.
Hello.
Hi there.
Hi. Sorry, I couldn't get my microphone to work. I'm calling regarding about the quarantine, and there in your Concord's letter, it says the quarantine people can go out to go get their essentials. So how's that stay in place when they're quarantined?
So I mean, if we're talking about specifically like county guidelines as it relates to, are we talking about somebody who is actually being quarantined specifically because they are affected, or are we talking about just in general everyday individuals?
I think because they're a suspect of infected or infection. It's in the Concord's letter.
Yeah. So
policy.
So the idea though is that if you need to be specifically quarantining, you're not able to go out. The goal is for you not to be able to access, and that's also something, if you're being quarantined for a really specific purpose, then there probably should be a connection with the county, and there probably will be some other services that the county can go ahead and connect with just to make sure that those people are staying in place. So if you, what's that? Sorry, hold on one second. Okay. So in terms of the other information that we did send over, though, it was kind of the county's guidance. So we're trying to be really mindful of people not going out if they don't need to. So again, if it's something to where is this a older individual, could they use Neighbor Express to be able to go get an item or two? Could we do a non-contactless, delivery with Safeway or one of the other services? It's just trying to get people to kind of be really, really mindful of that and not going out.
Are you keeping track of these people? I mean, why are they quarantined anyway? So is there a contact that you guys are, is it controlled? Because, I mean, I could be going to Safeway and these people are asymptomatic, but had contact with people and could give that the virus out,
Yeah.
or
So if it's someone specifically who has been identified as being quarantined or asymptomatic, the county actually will identify those people, and there'll be a whole different set of precautions in place. So that individual won't be allowed just to kind of be out and about, but the county would actually be handling that very specifically.
okay, and not Concord at all. I mean, we want to keep our city safe.
But that's something that a lot of people, and I want to make sure everyone understands, the city of Concord doesn't actually have a health department. So we're not like the city of San Francisco where we have a city health department because it's city and county. So all of the major health components to that get forwarded to the county, and then the county would help execute on those. So that we're kind of working in partnership with, but it's not being executed by the city of Concord.
Oh, okay.
Yeah, so that's the partnership. That sometimes there's kind of the question mark of people wanting to necessarily think the city's going to handle that piece, but it's just because of how our departments are set up to do that.
All right, thank you.
Okay. All right. Well, with that, we're going to go ahead and wrap up. Thank you all so very much, and we'll catch
Mayor McGallian, I have a question.
Oh, sure. Who's this? Wait.
So I've estimated that there's 1,000 homeless people in Concord. How is putting 10 people or 17 people up in hotel rooms and putting 3 porta potties out addressing their impact on being COVID-19 vectors?
So, a lot of that is in response to our bathroom facilities that are closed at this point in time, in terms of taking care of